Hello, my name is Dr. Anubha Sinha. I'm a board certified gastroenterologist. I am the founder and president of Huntington Digestive Health Specialists. I have been practicing over 20 years. Due to the alarming rise in colorectal cancer in young adults, let's discuss young onset colorectal cancer. Overall, colorectal cancer rates and deaths have been declining over the last few decades. Unfortunately, that benefit has not extended to younger population under the age of 50, where we have seen steady rise in both colon and rectal cancer in both men and women since mid-1990s. The latest statistics points out that colorectal cancer is now the leading cause of death related in young men and under the age of 50 and the second leading cause of cancer in young women. It's still not clear why young onset colorectal cancer is on the rise. There is more research that needs to be done, but as of now, what we know is that there are certain conditions associated with young onset colorectal cancer. Young onset colon cancer, meaning cancer that occurs below age 50, is usually located on the left side of the colon, including the rectum and sigmoid colon. These cancers are often diagnosed at more advanced stages and outcomes are not very favorable. Unfortunately, we do not know exactly what is contributing to the rise in colorectal cancer. It is thought that environmental factors may play a role, perhaps diet and lifestyle, obesity, diabetes, low fiber intake, high red meat consumption and sedentary lifestyle, processed food, cigarette smoking, and excessive alcohol use. There was also an article suggesting that baby boomers in the 70s and 80s had high antibiotic exposure, which may have altered the gut microbiome, leading to more polyp formation and colorectal cancer. However, more research needs to be done, and there are probably multiple factors involved rather than one single risk factor. The most common symptoms of young onset colorectal cancer include rectal bleeding, blood in the stool, change in bowel habit, constipation, persistent abdominal pain, unintentional weight loss, and lab findings such as iron deficiency anemia, which can manifest as fatigue or shortness of breath with exhaustion. However, most early-stage colon cancer and polyps have no symptoms at all. This is why screening is of utmost importance. The United States Prevention Service Task Force changed the recommended age to begin colorectal cancer screening from 50 down to 45 years old. If you are at average risk and have no family history of colorectal cancer, screening should begin at age 45 with a colonoscopy. Even if you do not have symptoms, you should talk to your doctor about getting an age-appropriate screening colonoscopy. On the topic of prevention, there are modifiable and non-modifiable risk factors. You can modify certain risks by becoming more active and working out at least 5 times a week, avoiding a low-fiber diet and excessive red meat, shifting towards a more Mediterranean-style diet, and limiting alcohol and cigarette use. Most importantly, if you do have symptoms such as rectal bleeding, change in bowel habits, anemia on your blood work, weight loss, or abdominal pain, please do not ignore them. It is not okay to say you are young and dismiss these warning signs. You need to come to your doctor and to discuss your symptoms and undergo appropriate testing, such as a colonoscopy at that time. We understand these symptoms are not easy to discuss and can feel uncomfortable. Middle-aged and young individuals in their busy 40s and 50s are often busy with their lives, but early diagnosis at an early stage is a key to success. Seek help promptly because early detection can truly save lives.